Hello, Barack. Good afternoon. Please, I hope you are doing well.
Hi, David. Good afternoon. How are you doing?
I'm
Doing
doing
good
great
for my end.
too. Yes, I'm doing
Awesome.
great too. Please ask Marty if he will see my presentation.
Okay, sure. Let me just confirm
I think
that. But
I
yeah,
copied you too.
okay. Yeah, I can see. I can see it. Okay.
Yes. So I'm trying to log on my computer. Because I'm using the phone now, and I'm not sure I'll be able to present it. So I'm trying to log in the computer so I can project from the computer. Just in case there's any technological failure, I have both working.
Oh, okay. All right. All right.
Hi, everyone. Yellow. Hello.
Good afternoon. How are you?
Hey,
afternoon,
Tom. Good
Teacher Christina.
afternoon. How are you?
This is Tom. Greetings from Lake Victoria, Central Region.
Hi, Tom. How is
Hi.
the Lake
I'm all right.
region?
I'm all right. Oh, no. I wanted to use my video for a bit, but I know it will break. Here, there you are. It's going to be for a brief moment. I'm going to switch it off, but at least you're able to see me. You know, today is World No Tobacco Day. I don't know if you know that. Yes, and I have it there at the background. You can see. World
yeah, I can see.
Tobacco Day. Yes, right. we try to be as proactive and in the moment as much as possible.
Awesome. Yeah, see, you are walking the talk.
Yeah, so thank you very much for having all of us, and it's a pleasure and an opportunity for us to be able to meet and talk about stuff, you know, in the moment as it is. Yeah.
I agree. Thank you for being here. We're just waiting for Marty to join in and some invitations also. Then we can start probably in the next 2 or 3 minutes.
Good afternoon, everyone.
Good afternoon.
Good afternoon, Martie.
Hi, David. Hi, Tom. Hi, Tusile, Christine. Nice to see you.
Nice to see you too.
Thank you. It's nice to meet you too.
Yeah, so I think we just give people 2 minutes and then we'll be able to begin. Is that okay?
Yes, that's fine.
It's not a problem.
Is that 2 minutes African time or 2 minutes American time?
2 minutes Africa standard time, normal time.
All right.
Yeah.
Then that would be an hour.
Thanks. Yeah, I think we're good to go now. I think the rest of the members will just join us as we go along. So just once again to welcome all of you who are able to make it for this call. We're hoping to have an exciting session. My name is Martie Mtange. I'm the People's Vaccine Alliance Africa Coordinator. I'm here with my colleagues, Barak and Takuzo, who can go ahead and introduce themselves. Go ahead, Barak.
Great. Thanks, Martie. Hi, everyone. Welcome for our session today. My name is Barak Owino, supporting People's Vaccine Alliance sub-grants across the 5 regions in the COVID-19 advocacy support. Nice to meet you all. Thank you.
Thanks, Martin. Good afternoon, good morning, everyone. My name is Takuzo Kampira. Welcome you all to this session. I'm the membership coordinator for PVA Africa. I look forward to having a fruitful session with all of you. Thank you.
Yeah, thanks a lot for introducing yourself. We work closely. As you can see, we're a close-knit team. I think since we're not too many right now, I think it's okay if we go ahead to at least know who's on the call. You can just go with the format of introducing yourself by your name, the organization you work in and your role, and what your last meal was, just to make this a bit more entertaining. So I think we can start with Tom and David, and then everyone else can pick up after that.
Okay, so my name is David KMC. I'm the founder and executive director of Youth Rise International, a youth-led organization in Ghana. And I'm happy to be part of the PVA Africa Alliance. I just took Coke with some ice cubes and pastries because I'm on the field, so I'll not have a chance to really eat well. That's what I just took. Thank you.
Tom. Dr. Tom Muyunga Mkasa. Right now, I'm in one of the places in Uganda. It's a rural part of Uganda, 200 miles away from Kampala. I'm being hosted by one of our satellite organizations under Advocacy Network Africa. It's called Public Health Foundation Uganda. This is where I'm basing to talk to you. Now, you said something about our last meal. My last meal was actually a tilapia from Lake Victoria. And then the dessert is sugar canes, which I have right now here. Thank you.
Okay, Christine and Felicilla, you can go ahead.
Good afternoon. I'm having a problem with the video. My name is Christine Yahama, Good Health Community Programs, Kenya. The last meal I had last night was matoke. Glad to be here. Thank you.
Good afternoon, everyone. My name is Roderick Chogo. I am the Executive Director of Human Resources and Social Information Center here in South Africa. My last meal was chicken and pap. Thank you.
Yeah, you can go ahead. Roland and Winile, what we're doing is just introducing ourselves, the organizations we represent, and the countries we're based in, as well as the last meal you ate. Go ahead.
Okay, good afternoon, everybody. My name is Turisile Mazia from the Kingdom of Eswatini. I'm the Executive Director for a men empowerment organization called Sinatisa Lubombo, which means providing water to drink for the Lubombo region. The last meal I had was rice and chicken stew. Thank you.
Yeah, go ahead, Rolande and Winile.
Sorry, good afternoon, guys. Can you hear me?
Yes, we can.
Oh, sorry, man. I'm struggling with load shedding here. I'm battling to even get my gadgets connected properly. Okay, I guess I'll switch on my video. It's some time later on. My name is Winnie Lemapogo. I'm the programs manager for an NGO based in Cape Town, in a small rural town called Robertson. It's mostly known for its wine farming. And I'm responsible for an organization called ASU's Foundation for Development, which is a food and security program in the Western Cape, supplying, equipping small-scale farmers on. Thanks.
Lastly, we have Roland. Roland has been gracious enough to put his introduction into the chat. Unfortunately, my French is rusty at best. But from what I can understand, he says, hi, my name is Roland Absaya for the Foundation of Association, or that is where my French ends. But Roland, we appreciate your presence here. Thank you for making time to join us. I hope that you'll be able to understand what we speak about today. And I'll just go shortly into the introduction of who PVA Africa is. We're glad to have you as our members, but sometimes it's good for a refresher into what we do, why we exist, and why we are so happy to work with you as well. So basically, PVA Africa is an organization that is a subset of the People's Vaccine Alliance. So our work and our passion is to represent the work of African civil society organizations and community-based organizations in the work of the People's Vaccine Alliance. More recently, we have diverted slightly into a mission that is being for Africa, in Africa, and for Africans. And in short, that is to say that our work is to look out for the interests of community-based organizations and CSOs working in the public health sector, as well as gender and equality and health justice fields of African CSOs. So what we do is we advocate for CSOs and CBOs on the larger scale, on the global scale, as well as recently we have started granting in terms of helping organizations that align with our vision to achieve impact in their specific areas of operation. So we have 5 sub-grantees at the moment who we're working with in all 5 regions of Africa. That's North, East, West, Southern, as well as Central Africa, to achieve public health impact in the specific projects that they've decided to partner with us on. So that's what we're doing at the moment. We're in the middle of developing a strategy. We're actually in the closing phases, and this is a large part of the strategy because you are important to us, and our members need to know exactly what we have been up to, what we're doing, keep them abreast with what's going on in the public health situation across the globe, and have us represent you when it comes to the People's Vaccine Alliance conversations globally. So that's what we do. And on the larger scale, we are housed at the African Alliance. That's our big brother. The African Alliance is basically a non-profit organization that works across diverse portfolios, including work to ensure that communities in all their diversity are meaningfully engaged and all aspects of COVID-19 research, development, and eventually equitable access are achieved. So the African Alliance is our father and mother, to put it in that way, if it makes it more understandable. And we're glad that you're able to join us for this session. So the agenda is basically to have an introduction, which you've already done. And then we were gracious enough to have David and Tom, David from Youth Rise International, as you said, and Tom from the Advocacy Network Africa, talk to us about the work that they do, how they've been making an impact throughout the COVID pandemic, and also, I don't know how many heard about the 5th May World Health Organization declaration that COVID-19 is no longer a global health emergency. And it was Dr. Tedros who made the announcement alongside the WHO main committee, which basically says that they'll step down their efforts and start focusing more towards pandemic preparedness. Yet we know in Africa, not many countries have achieved the 70% full vaccination rate that the WHO itself recommended. So part of this discussion as well will center on that, and just getting some of your reactions and what the perspectives are within the organizations and the countries that you work in, as well as the networks that you influence, just to get some of your reactions on that and see how all together as PVA Africa membership, what can we do about this? How can we continue to help our people, particularly when it comes to vaccine access and health justice? How can we remedy the situation? How can we continue to protect our communities from COVID-19? So I think it's best for me to give the PVA Africa updates after David and Tom have been able to talk to us about what they're doing. Then PVA Africa can tell you what we've been doing over the beginning of the year and what we've been able to achieve, as well as gain some of your sentiments about how we can achieve more together. So I think at this juncture, I'll give the floor to David, David Ausi. David, you're welcome. We are so excited to have you and to hear about the work that you do. And congratulations on the opinion article that you posted on maternal health recently. It was a really good read. At least the media training that Frey helped us with has had some great impact, at least for you. So we'll have David talk to us about what he does, as well as his reaction to the WHO recommendation. And then we'll have a few questions from the audience, if you have any, and then Tom will take the floor thereafter. So thank you, David. The floor is yours.
Okay, thank you so much for once again for the opportunity to be part of this important platform. It's always a pleasure to share and learn and to enjoy from the diverse experience of members of PVA Africa. So I put together some presentation. Let me see if I can share that. So I know, we have a limited time, so I will not be able to go forward, but it will be a good resource that people can. Can you see my slides? Is it up?
Yes, we can.
Can see that. Okay. So as a person, I'm David K, and I'm the founder and the executive director of Youth Rights International in Ghana. My passion for this work stems from my own childhood experience of poverty and obscurity, social exclusion. Right on the screen, you can see a house, a mud house with a thatched roof. That's where I was born. I live with my parents and 3 siblings for the first 9 years of my life before I lost my mother and became an orphan at age 9. I had to drop out of school to take care of my 3-month-old sister who was left behind after the demise of my mother. I've seen poverty, I've seen hunger. There were days that I would virtually cry and I wish to die because the hunger, the pain, the obscurity was too much. But some way, somehow, with determination and persistency, I happened to rise up to become the first university graduate in my family, to have multiple masters, and become an international activist and currently pursuing law. I believe that this is the foundation of my passion for Africa and public health and the work I do at Youth Rights International, because I have a lived experience of extreme poverty and social exclusion. And sometimes I sound a bit, sensational, emotional about issues when I talk about Africa, but I really know what it takes for people to be in obscurity and struggle to have a daily bread and suffer all these kind of public health issues that we're talking about. So that's kind of a little background of me. I'm a social entrepreneur and consultant as well, running the Youth Rights International and then Community Associates as a developer consultancy firm in Ghana and several other things. Our goal and our vision for Youth Rights International is depicted in this picture. We want a prosperous Africa, we want a healthy Africa, we want strong families. So we are looking at mobilizing young people and grassroots communities to create African continent where there's shared prosperity for all, there is healthy and strong families. And this is what we stand for at Youth Rights International. I also want to add that before I even proceed, being part of the people of Asalia, even for the short time, has really impacted us. Our perspectives on public health issues have really deepened, broadened. Our understanding of the media dynamics and media engagement has deepened. We've had some kind of exposure of our work, and also our technical capacity on advocacy and policy influence have been enhanced. Of course, the good news is that I've already shared the feature article on 2 platforms. I just had a third one of the most vibrant, called myjoyonline.com. Joy News has picked it up, so I have a third publication I'm going to share. And then Daily Graphic, the widest and the most credible newspaper in Ghana, Daily Graphic, has picked it up, and very soon I'm expected to have it in the Daily Graphic. So, I mean, these are all possible to be part of the media training and receiving coaching and mentoring for Paula and Barack and all of you, and something that we're really proud of, and we're happy to be part of this family. In terms of what we do at Youth Rise International, basically, like I said, we mobilize young people and grassroots communities to fight the root causes and intersectionality of to fight the root causes and intersectionality of extreme poverty, climate justice, and maternal and child health. So specifically, we have a project that focuses on maternal and child health, and that's a project that we are running currently. We are looking at targeting over 10,000 people in Ghana in terms of awareness and public education, focusing on addressing issues of newborn and child mortality, and then also advocating for the government to do training for health workers and restructure the health facility system in the way that it's more teen-friendly and it's trauma-informed, so that adolescents and teenage mothers would find health facilities more welcoming instead of avoiding it and then resorting to unauthorized and unapproved herbal medicine, and that increases the risk of maternal and child mortality. We are very strong on climate issues because we are standing for smallholder farmers and fisher folks whose main source of livelihood is on agriculture, and climate change is really impacting strongly on agriculture, what is impacting on the economic level of smallholder farmers and the majority of Ghanaians in the rural community. So we are doing some kind of education on the mitigation and adaptation issues. And social protection and decent work, we are very strong on youth and employment, considering the huge number of young people in Africa who have no job, and increasing the insecurity and the youth riots and all the public issues that we are having. And then policy advocacy and research, something that we are very strong about. So in terms of impact, we've been able to impact over 170,000 people across the various thematic areas that we focus on. We are very keen on learning, accountability, and sharing. So we document a lot of the impact of our work, and so this is what we can be able to achieve for the little opportunities and resources we have over the years across Africa. Now, in terms of Africa, you know that COVID-19 has really devastated the economy. Lives and livelihoods have been impacted. More than 70 million people have really fallen into poverty globally as a result of COVID-19. It has also impacted the public health space across Africa. Africa is struggling with communicable diseases, material crisis, and the shocks of climate change. But more importantly, at least according to WHO, over 100 health emergencies are recorded in Africa. So we think that these are some of the gaps that exist and the call to action. We believe that there's supposed to be an urgent paradigm shift towards health promotion and well-being. Of course, it's popular to say that prevention is better than cure. So we don't want to wait for public health outbreak of any kind of disease before we prepare ourselves, but we should rather invest more time in health promotion and ensure the well-being of the people. We also we think that there's the need to prioritize disease prevention and also deepen health behavior change communication. That's something I'm really passionate about, because the dynamic of always just raising awareness and sensitization is not working, because people's health behavior is deeper. It's informed by their religion, their faith, their personal value system, culture, and tradition. So we need to target behavior change. That's something that I'm quite an expert on in Ghana and across Africa. We also believe that we should leverage on technology. I mean, we learn a lot of lessons on COVID-19 and how technology plays a role in tracking and everything. So, and more importantly, we need to really prioritize emergency preparedness and response, which is a proactive way to really prepare ourselves against any public health emergencies that is likely to break forth, which we can't predict. But I also have a strong reservation on the WHO announcement that COVID-19 is not a public health issue. I don't think that, like Martie said, we don't have the 70% threshold that we gave to us. So if you announce this break, do you want to demoralize people? Do you think that resources will be allocated to this thing again? I don't think we are ready for that transition. As much as I believe that we need to really work towards emergency preparedness and response, we really need to go ahead and push for the vaccine equity, something we really strongly support. So basically, I think that there's hope for Africa. Africa can prosper and be great, but I believe that the youth of Africa are the work ahead to really shoot the continent into a space of prosperity, equity, and sustainable development. So I don't know what I will do to work within my 15 minutes, but I try my best to rush a bit just to beat time. But I'm sure I will share the presentation and people can have it and go through. And if my time is not up and there's any question or any opportunity to answer any question anyone has, I'll be grateful to share. Thank you very much for the opportunity. I'll be grateful.
Thank you so much, David, for taking us through, first of all, your inspiration, your background, where you came from. It was a great start to share the heart that you shared, and for being brave enough to tell us where you've come from and what drives you, and especially when it comes to Youth Rise Ghana. If anyone has any questions, this would be a good time for David, but just to kick off the questions, just to get your perspective, David, on the WHO declaration about COVID-19 no longer being a public health emergency, and what that has meant for your organization, what that means in the wider scope of things and activities that you take part of in the public health space in Ghana. What does that mean to you?
Okay, so thank you very much once again. Like I just said, I believe that I have personal reservation on that announcement because you gave us a 70% threshold for vaccine. We are not there yet as a continent. So if you come back and say it's not public health emergency, it has a lot of implication for us. Already, there's been a lot of vaccine hesitancy in Ghana, and I'm sure it's not too different from Africa. So if the ordinary person sits in the radio and then hears that WHO, such a good authority, saying that it's not public emergency, it's currently being misconstrued that COVID-19 doesn't even exist, because that they believe that a lot of people in the rural communities keep hold, and that's one of the reasons they were resisting the vaccine. So, and apart from that, then it gave politicians a chance to lay back and say, look, this is not even a big issue. You don't need to come and bother us about investing in vaccines and all the expenses and how we have to invest in the health system to make sure people can get their vaccine. So it really impacts our advocacy drive. It also really impacts us in terms of how the grassroots community that we work with will accept the vaccine and the vaccine equity that we are pushing. Something that we think is too early for such an announcement to be made. That's our organizational view.
Thank you so much, David. I think you captured so many of the points that we also believe in as PVA Africa, and what this means for Africa. That's why it's so important to have these kinds of sessions, just to get those perspectives and to understand what more can we do about it, you know. I don't know if anyone has any other questions, or we can proceed to Tom. Great. Thank you so much, David. I think once we've had some time to think about everything that you've said, it's possible that we might have combined questions for you and Tom. So without any further ado, Tom, I hope you're ready. The floor is yours.
Thank you very much. If you are hearing something in the background other than my voice, it's because I'm also in a newer city and they're trying to announce new roads, you know, new buildings, new municipalities, you name it. People are engaged in civic duty and participation. The reason I came to this point, I came to this area. This is one of our satellite organizations. It is mostly a rural location, but they've been given a city, and they're trying to come up with all these organizations. Now, without much ado, first of all, I'm Tom Rogers Muyunga Mkasa. Background is I'm a medical doctor and a global health promotion specialist, mostly with I'm specialized in infectious diseases and epidemiology and all that. But at the same time, I'm also specialized in community organizing, linking communities to health-seeking practices. Now, our organization is known as Advocacy Network Africa. Well, I'm going to ask, I understand if you can share the screen from your end, and then I'm able to ask you, Owino or Kampira or Mtange to be my moderator, please. Every time I just say, then you know that I'm asking you to switch the slide, right? So that then I am able to be on my other end, right? Is that okay? This is an interactive way of doing it. Is that okay,
Yeah.
Marty?
Yeah.
All right.
It's fine. Yeah.
Yes. So let me exit my full screen while you are also sharing. Now, I named this our lunch hour at the People's Vaccine Alliance. The idea for me was, because many of my staff, well, not but part of my staff here are also hearing in, listening in, while they are also, we are also conducting voluntary male medical circumcision. And I wanted to supervise some of these. So they are here trying to work on the books, but I wanted to make sure that I can be my voice, and so that they get to know that all of them are included in this session, which we call the lunch hour at the People's Vaccine Alliance. And we are grateful that you invited us. Next slide, please. The African Advocacy Network is a public health promotion and education non-profit organization working in African countries. Actually, right now we've worked in 25 African countries. We want to work with all the 55, but physically I've visited all the 25, but virtually I've actually been around all the 50 plus. And the idea is work with grassroots communities, empower them to embrace what are known as the UN observances. Like today is the World No Tobacco Day. So we encourage CBOs to engage in the aspect and aspirations of WHO, World Health Organization, on reducing the risks that are brought about by tobacco, as well as looking into the workplace conditions or even importance of those people who are engaging in tobacco growing and all that. Well, it is a whole continuum, but at least it builds consciousness on prevention continuum, as well as working hand in hand and empowering people to understand what they have to the perspective on interests and how they affect their lives. All right. Having used the public health principles to link SDGs and all that, the three principles that we dwell on or specialize in are preventing diseases, prolonging life, and promoting health. This time, not just mentioning the words, but for all people, for all age groups, mindful of the diversity of humanity. And this is where we loved People's Vaccine Alliance Africa, because even with them, when it comes to diversity, they mention it affirmatively and intentionally. It's as if we all went to this school of critical race theory analysis, and we bring out the humanity and we break it down, unpack it into what it is composed of, as well as the elements. Now, we go an extra mile. We intentionally and affirmatively work with refugees, displaced persons, and asylum seekers in Africa. And so far we've worked in 7 countries where there are refugees. There's this element of reaching out to people geographically, right? But these are people who are now disrupting our geographical understanding of outreach. So now, instead of the horizontal outreach, now this is the vertical outreach, which is a dimension of humanity. They cannot be located geographically, but, well, no, what I'm saying, they can be located geographically, but in a host country, not their places of origin. But even in the host countries, they are somehow submerged under other definitions. So for us, we try to reach out to them so that then we define them as part of the humanity, the vertical definition or character of humanity. Next slide, please. Now, our vaccine and new drugs research and development advocacy. You realize that I've skipped so many things and I've come straight to one of our activities, which is vaccine and new drugs research as well as development. Actually, it is vaccines, new drug, clinical trials, advocacy, and advisory in Africa. But because this is some other way of, like defining it, I thought this would be better. Then what we do under this, we also utilize a model known as adaptive public health, as opposed to just public health that is taught in universities and schools. This is now models that address lived experiences. So adaptive public health approaches are the ones we use to engage communities to create better life outcomes. And for us, as much as possible, some of the questions that we want to ask our beneficiaries are known as the life outcome experiences. We want to capture them. And I'm going, later on, I'm going to show you the narratives and the definitives or the character or the elements of what we mean by life outcome experiences. And then we capture them as narratives, and we want to start, training communities to be able to speak that language. Well, before we get there, these are some of the steps of community organizing, community diagnosis, communities of practice, even this very space where we are interacting under the auspices of PVA. Actually, because we allow us to, you are also talking to us, we are listening to each other, we are sharpening and polishing each other. This is actually communities of Now, we also use to appreciate PVA for seeing who we are and then allowing us to come and, brand ourselves, continue, disseminating who we are and sharing with you our experiences. Next slide, please. Next slide. All right. Vaccines and new drugs. Now, I wanted to go deeper into this. We work with communities to raise consciousness about good health and well-being. But as we are doing it, we are also building rapport with them. And in the process, we mainstream vaccine and new drug demand creation. Why did we stress that? In almost all the communities we work in, when we ask the question, how many of you have taken COVID vaccination? And we say, don't worry, we are not going to shame anyone. I'm telling you, if we have 100 participants, sometimes it's only 3 participants who raise their arms, and they tell you it's because we've never heard of anyone dying of COVID. Or this is Africa, the sun kills the viruses and all that. So, and from that, we learned that actually uptake of COVID vaccination was so low. And thank you, Martie, you mentioned it. We've not even hit 70%. Actually, it's a few countries, Egypt is one of them, which hit not even 70, but at least 55 plus vaccination coverage. And this is why we thought we would use our spaces to also bring in vaccine and new drugs uptake, so that we then address issues of hesitancy. Next slide, please. Now, again, I want to share with you, and I wanted us to go deeper into what we meant by good health and well-being. And for us, we defined it, yes, using the WHO, using the SDGs and all that, but we stressed it, instead of just saying health, we want to bring, to appropriate, to borrow the SDG 3 and be able to, make it a lived experience, make it an everyday imperative. So for us, it is a state where people experience physical, emotional, and social wellness, not well-being, because then when it comes well-being, then they will relax. But when you say wellness, it is an everyday thing. And then we come up with action points, action plans, so that they're able to continue working on that wellness. Every day, it's an everyday thing. Thank you. So then we then made them into what are known as the context, the political, social, economic, cultural, gender, civic, physical, and lastly, social context and an enabling response, rather an enabling context. So we tag good health and well-being to all these contexts, and then we show them how they can be able to verbalize lived experiences as well as good life outcomes. Next slide, please. Next slide. Now, I wanted to share with you the narratives, because one of the reasons why we go to communities is to also research and be able to come up with their own experience, their emotional experience. Remember, we said for us, good health and well-being is physical, emotional, and social wellness. Now, once we are able to capture what's emotional, that is the words they share with us, their experience of the physical as well as the social is translated in their emotional, communication with us. Now, one of them is that we liked immensely, and this is what I've highlighted. Number one was an expectant mother who is not forced to choose between buying food or attending an ANC during the third trimester. That sense of confidence and wellness, that she has some money left after she has fed the family, herself, at least she has some money left to go and attend ANC, because normally in mother and child health care, one of the indicators of good mother and child health care is mothers who are expectant to be able to attend their first ANC visit during the third trimester. All right. Then number two, a father being able to afford taking himself, partner, and partner for full medical, and children. That's what I wanted to say. Children for medical care regularly. And then third, a household where members are assured of stability, food security, sustenance income, and engagement in biodiversity care. The aspect of conscientizing communities to care for Earth, to care for the environment, is another aspect that we added on when we go to visit or when we empower communities to engage in health, good health, and wellness. Then fourth and last is a farmer able to vaccinate both livestock and vaccinate both livestock and human family members, able to afford climate change countermeasures, addresses crises, calamities and crises, sorry for that, and not affected by catastrophes. In order for us to live the experiences of proper public health, which is prevention of disease, prolonging life, and promotion of health, we have to again conscientize, raise the consciousness of our people, you and I, to look into the entire ecosystem of the factors that affect our life. And if people are empowered to look at life from the ecosystem point of view, what is known as the One Health, then they will be able to be driven to engage in other aspects that would actually affect their immunity, either in a negative way if they don't mind about it, or in a positive way if they actually engage. And like I said, it is an everyday activity. And yes, these are some of the narratives that we capture from communities to be able to share. But the point in number 4 that I also wanted to share with you, because I'm also a One Health practitioner, we tend to forget that we are all animals and we are living in an ecosystem where we actually benefit from Earth. We can't live in isolation. We can't say we are all round, like we are all and everything, unless we are also able to say that we care for Mother Earth. But at the same time, when it comes to vaccination, most of us tend to think of human beings only. Yet, actually, most of the vaccine-preventable diseases in livestock, if people were also engaging in that, they would be able then to save their livestock and benefit from, economically from vaccinated livestock. So for us, we also try to advocate for vaccination in its entirety. That is animal and human relation, that ecosystem, as well as climate change, because now we've started having invasive plants invading places of our gardens, rather places where we rear our animals and all that. So when we conceptualize, when we raise consciousness around that, people then will understand what it means to live a fuller life experience. Next slide, please. All right, now we come to the point, whose COVID no longer a public health emergency? For us, it is anti-people and anti-SDGs. Why? COVID as a disease, I've consulted with World Health Organization, and I've asked in one of my submissions, one of my interventions, is to ask the doctors at World Health Organization to stop looking at the world from the lens of diseases. They should now start looking at, we call it a boutique approach. They should start looking at what we call long-term life approach. So because the World Health Organization tends to look at everything from the lens of disease, they forget the socio-economic and cultural dimensions. And I'm sorry, and I apologize on behalf of other doctors, medical doctors, because I'm one of them. So those of us who have also been trained, in the area of public health, we are the ones now impressing upon our other doctors who have gone further into medicine to also look at life from the social, economical, cultural dimensions. So now COVID affected, you've heard of social determinants of health, but this time we now also see COVID as a determinant of social determinants of health. So World Health Organization had to look at it from that angle. So in declaring COVID-19 as a disease and as a non-public health emergency, they missed the effects of COVID-19 on the socio-economic, cultural dimensions of life. 2, these became the silent pandemics. You're aware that we still have long COVID, we still have child parents. I'm sure so many households, and I'm asking PVA, maybe engage all of us in a research. Maybe get us some money, and we do research, and PVA owns the report on child parents. In all over the countries I've traveled, there is this silent, rather pandemic. Then thirdly is post-COVID stress. So few people are talking about it, the psychological effects of COVID due to gender-related violence, intimate partner violence, and general violence, the general characters of violence. Again, PVA, maybe we can take it on. After all, we can do that. We are all public health specialists, and we are all, at least have a glimpse of public health. And then the second last point is job losses without recovery plans. I only wish that World Health Organization would, work with a World Bank to come up with, briefs on recovery plans, as a result of job losses and all that. And then lastly, lack of recovery and resilience suggestions. You declare a non-public health emergency, but then you forget that you're actually the very first one who is saying social determinants of health. And then COVID came, COVID told us that actually there are other variables. We thought that health is dependent on social determinants, but then we've realized that actually even health is dependent on calamities, dependent on climate change and all these other, catastrophes. So we also need to factor in these and then train communities in what are known as climate change countermeasures or political crisis countermeasures. There's no one, or very few people are talking about that as well. So this is why when I felt PVA is giving us this space, I felt this is a space where we can, be able to talk about this along these lines. Next slide, please. Now, who is Tom? Tom is trained as a medical doctor as well as a political science. Actually, I was supposed to do anthropology, but then I went to do political science because I wanted to understand the language. To train in the language that I'm able to use so that I'm able to be called at a panel like this and be able to come up with narratives so that people can get to see the deeper issues of politics, which means how people relate with Earth, how people relate with any other aspects that interest or influence their interests. And that is what is meant by political, as opposed to any other, machination of votes, rigging and all that. But true political science is about that. Now, I'm also a global health promotion specialist and strategist. So I can come to an organization, work with them, empower them, strengthen their public health approaches. And this is what I do. So that's why I'm here in Uganda with the Public Health Foundation, Uganda, and I've been here for 2 weeks, empowering them in what is known as adaptive public health master classes. And I've taken them through that. And maybe PVA can also organize so that when we are able to work with all the CBOs that are under PVA, because after all, even when we have over 5,000 CBOs, that means that automatically they become PVA what? PVA CBOs. So that means PVA can confidently say that working with our partners, we are able to again be able to, to pass on knowledge and information and all and services through them, and then reach out to other CBOs. And then maybe it's going to be the last, next slide. Next slide. Yes, thank you. We reiterate contributing to the collaboration we have with People's Vaccine Alliance for Africa. So for further information, those of you who like, to read, to see what we are doing out there, there's a blog. We had a website and it crashed like so many times because we feed it in so much like reports and all that. So we said, let us then go on to another website that is known as blog sites. And that's where we are putting all our materials. But soon, if PVA can, give us some little funding, we are going to come up with a website. And then maybe lastly is, I'm asking you please to work on that recommendation letter, so that then I send it to the Institute of Vaccination, because I'm also also because I told you my specialty is infectious diseases, and further on my post-PhD was vaccinology. So I'm also a vaccinologist, but for me I took the angle of community, uptake, and because there's so much hesitance when it comes to vaccines. So please empower me, sending that recommendation so that then I'm able to send it to those people so that then we compete. After all, we are competing for a slot that maybe we allow only 5 people, but I'm sure with PVA recommendation, I don't think anyone can beat me. And then with my, experience and all that. I thank you very much. We thank you actually very much for allowing us to be part of the lunch hour talk. Maybe if there are any questions, I'm ready to respond. Thank you.
Thank you so much, Tom. I'm happy to tell you that Takudzo responded to your recommendation email. So I think that has been taken care of. So we wish you all the best. Thank you so much for your presentation. It was really insightful, very informative. Thank you especially for covering even the silent pandemic parts. We have noted what you've said regarding research on silent pandemics, particularly to do with the child parents. And we'll see how we can take this further with you as well. So thanks a lot, Tom. I don't know if anyone has any questions at this point, but just to ask a question myself, what lessons, and this is open to anyone who would like to respond to it, but what lessons do you think as Africans, especially African CSOs, as African public health specialists, what lessons have we learned from the pandemic, the past 3 years, as Africa, especially in relation to pandemic preparedness? What can we do differently, God forbid, if this was to happen again?
We should invest in health.
All right, let someone go and then I'll follow.
Go ahead, Christine.
Governments should invest in health. Especially, they should set aside funds for pandemics. They should be allocated in the budget. I can give an example like now in my county. Since we had the COVID-19, every financial year, we ensure that they've set aside money for pandemic and also disaster. That one is a plus on our end. And then on COVID-19, let me appreciate what our Thomas shared. I'd like to say I work at the sub-county level, that is in Kakamega County. And what we are doing at the moment, the CSOs and county government, especially the Ministry of Health, we've partnered, and what we are doing is that we are doing door-to-door mass rapid response of COVID-19 vaccination. And I can say our country, we are doing well because we have the boosters, but the community are not aware that we have the boosters. So as we are doing the rapid response, it's when now we are trying to sensitize it to the community, and now they are picking up with the injection. Otherwise, we were doing badly because of the myths that were there and misconceptions, but now it has been addressed. Thank you.
Thanks a lot, Christine. You can respond, Tom, and also Nomfundo. I was very curious about your comment. So after Tom speaks, perhaps you can just elaborate a bit more on what you mean.
All right. First of all, you remember when I said medical doctors of the past tend to look at the entire universe from the disease point of view, from the risk point of view. Now, again, public health trainers who are trained in that area tend to look at public health as if, one, you're supposed to inspect water and sewerage contamination, all latrine coverage, all food handling. Forgetting that actually public health feeds into all professions. If a bridge, actually one of the reasons, Christine, I'm from Nairobi. That's why we have our headquarters, but I failed to move from this side back to Kenya because where I am, the bridge fell in and the waters of one of the tributaries of River Nile broke through, so we can't travel across. Now you can imagine that is a public health influencing issue. So even engineers, like all of us. So once we start looking at public health from a life outcomes point of view, then African CDC will actually be able to impact communities. But because we still think of public health as people who visit our houses to give us certification plans, that we are having ventilators and all that, once we shift from that thinking and go to the life outcomes, which public health actually informs adaptive public health. And this is what we do. So then secondly, Christine, you've said it all, I can't add on to the points, but the third point is PVA or these other organizations. What is your new adaptive public health curriculum, your syllabus that you use? Like if I came to you and did what is known as adaptive public health analysis, like an audit, because you are a public health organization. And I'm not saying that I am dismissing what you're doing, but because this is my specialty also, I trained for 2 years to come and see public health systems and structure thinking of organizations. You know, the ones that have gone through, you find that all they say is public health. And then you say, right, translate it into life outcomes. And they're like, we are waiting for funding to do this. And you're like, no, there's something you can do even before you do funding. So that mindset, systems and structure-wide thinking is what we need to also bring into, so that then we are able to look at public health from the ecosystem point of view, as well as the life outcomes point of view. Thank you very much.
Thank you, Tom. I think now you are headed to where we are calling primary health care. Now it's coming handy with what you are saying.
True. That's true. Thank you.
Thanks a lot for that, Storm. I see Nomfundo has dropped off, but just to address part of what you're saying, and that's why this forum is so important, because PVA Africa is, as I said before, we are finalizing on our strategy, and just gaining these perspectives on how we need to view public health, not just as an illness, but as an ongoing, like in its totality, in its wholesomeness, and looking at the whole process of how it affects a human being and other human beings related to that. I think that's really important. That's an aspect that we need to capture in our strategic plan. But before I go ahead, I see David has a question. David, go ahead. You have a contribution. Go ahead, David.
Yes, thank you, Tom, for such an insightful presentation. I believe in the One Health model that's more integrative, and public health is a multidimensional, and so to have an integrated approach is more sustainable. Just some quick thoughts. I believe that public health, if you're talking about public health, it's important that we also highlight the role of climate change now and its impact on the direct health of people, its impact on the economic livelihoods, and how its impact on food security and nutritional content of food people will eat is really important to address those gaps. But more importantly, also the fact that we need to really be strategic in terms of launching a campaign to deal with the disinformation and the misinformation in the system. I mean, one of the things that made COVID-19 difficult to fight was the fact that all those conspiracy theories and something about 5Gs and all those that we had. So if you're going to have a sustainable public health solution for Africa, we need to look at being clear about what information we're going to send out there in terms of risk communications, behavioral communication. You're going to also look at the channels of communication and even multiplicity of language. It's not enough to have your accurate information, have it clearly written down, but you need to be mindful of which channel are you going to use and which language are you going to communicate through, so that you'll be able to get your target audience to receive the information and the communication content to influence behavior and shape their mindset. So I think it's really important we really deal with the misinformation and disinformation with a very defined communication content and targeted channels, and also considering language barriers, making sure that communicate in multiple languages that would resonate with the people. Thank you very much.
Thanks so much, David. I think your engagement with us, as well as Tom, I think it's been really enlightening, getting a perspective from the advocacy perspective, and then also getting the perspective from a medical and public health perspective has been really insightful for this session. Just to keep you up to date with what we've been up to as PVA Africa before I hand it over to Takudzo. I know so many of you were gracious enough to participate in our CSO survey. I think the point of the survey was just to understand how better we can add value to you and to these discussions, how we can make a change together collectively. And we were able to gather some of your sentiments, and Taku will present that after. But I think just for us, just to take 2 minutes to tell you what PVA Africa has been up to. Let me just share a bit on my screen. I hope you can see it. So PVA Africa has also been, Mark, please confirm you can see the screen.
Yes, we can.
Okay, great. Thank you for that. So PVA Africa, just as Tom has challenged us, the first thing I said is that we've been working on a strategy, because I believe that if you don't know where you're going, then you cannot really be too sure about how to get there. And that's been a really important question for us, especially now 3 years later after COVID. And COVID was definitely very devastating for us, but also at the same time, we want to work for the benefits of our African communities, not just in terms of COVID, but with all the things that are, all the diseases and ailments and situations that are plaguing our continent. We have TB, we have cholera, we have HIV, we have malaria. Just seeing in its totality, how can we work for the benefits of our communities, not just to survive, but also to thrive. and also in a way kind of prepare us in case this was to happen again. Where do we stand? What can we do? What lessons have we learned? Just as David and Tom have spoken about, as well as Christine has contributed to. So this is the wider ranging kind of vision, which is why when we complete our strategy next month, we'll be able to present it to you, just to get your input, for you to hold us accountable, for you to also kind of tell us what are we missing, what bigger picture are you working with in your context that we can also incorporate, so that when we're working together, we're all going in the same direction. So I'll be able to present that to you during our June meeting. But for now, here are just some of the things that PVA Africa has been up to. This is one of the regional infographics that we came up with, which is clear on our social media page. This infographic basically just says that COVID is not over for us. It's been 3 years and counting, but as we've repeated often, the 70% full vaccination rate has not been achieved. This was just to gain more perspective on this region, North Africa, East Africa, how many confirmed cases were there, confirmed deaths, people who are fully vaccinated. We have West Africa, Southern Africa as well. We have Africa in general. We incorporated Central Africa as well, to look at the statistics. What science telling us? What more can we do? And this can be made available to you if you're interested in it. So this is one of the things that we've been working on, just to gain perspective. But even as we move forward, we understand what we are trying to achieve. In addition to that, we've also been working on a film. This is called the Mother's Film. We finished the final edit, and Barack was really instrumental in this as well. It's a short film that's intended to shine a light on the violence of COVID-19 vaccine justice, and just spotlight the new generation of activists in South Africa and the USA who are fighting the lack of access to dignity and vaccines, to make sure that these stories are being told. We know so many people who lost their loved ones during the pandemic. So this film kind of spotlights on that, with a great focus on women and how women especially suffered during the pandemic, especially our African women. We lost sisters, we lost mothers, we lost friends, we lost relatives. We lost so many people. So this film just kind of shines a light on that. And we'll be keen to share that with you once it's fully done. We're hoping to launch it in June as well. So June will be a time of great activity for us. In addition to that, we've been conducting the media trainings as well. So we had media trainings for each region in coordination with Frey Intermedia Group. I know David was part of these sessions as well. And some of you sent your representatives also to be trained during those sessions. So we're just doing this so that even in your advocacy capacities, you're able to understand how to pitch to the media, how to engage on social media with the publics that you engage with, how to be more effective in delivering your message when you're going for an interview, how to conduct yourself and pass the message across in a way that everyone is going to understand what you're saying and receive the key messages that you're sending to them. So these were really impactful. We're happy that David has been able to also release the opinion articles. And we're looking forward to more of these from our sub-grantees, as well as if you have any ideas on opinion articles and you need some help, either editing or pitching, the PVA Africa team is always open. We just want to see you and the amazing work that you do put out there, so that we can celebrate with you, and so that our communities have even more visibility when it comes to showing what they're dealing with on the ground, what we're dealing with on the African continent. So yeah, that's just the basis of doing that. This is just the part that Takuzo will go through. We also have a lot of steering committee updates. We were able to present our strategy to them, and they were able to give us the go-ahead. And now, after that, we'll be able to share that with you. We've also been able to participate in several digital campaigns. We helped the People's Vaccine Alliance, the global team, to publish the G7 letter, which was published last week, just before the G7 meeting. We had 5 representatives from Africa, some from South Africa, and Dr. Alfred Gitahi from Kenya as well, who are signatories, basically just saying that it's not okay to give exclusive access to the vaccines to your Modernas, your BioNTechs, your Johnson & Johnsons. We also need that intellectual property so that on our own, we can also defend ourselves when it comes to vaccine production and vaccine access. So we were happy to be engaging in that. And our co-creation process as well, nothing about us without us. Basically, we want to put Africa at the front of everything that we're doing. So that's just a snapshot of the campaigns that we've been involved in. Yeah, Africa Day, Botswana is one of our projects as well. We were part of the Rio Climate Health Conference in Brazil. Just to share the African perspective, we were represented by Egypt, which was it was really impactful, just to talk about Africa's perspectives from the vaccine justice and how it integrates with climate change. So that's just to respect your time. That's a snapshot of what we've been up to. Unless anyone has any questions, I think I'll just hand over to Takudza, who's going to take us through the survey that we involved you in. And we had a small incentive where we had a raffle for 2 winners of some good prize money, just for engaging with us and helping us understand how to fulfill your needs better. So I think, Takudza, you can go ahead.
Okay, sure. Thanks, Martin. So I'll just share my screen. Okay, Marty, can you confirm if you can see my screen?
Yes, I can.
Fantastic. Right, so thank you, Marty, again, and good afternoon, colleagues. So as you are aware, PVA Africa conducted a survey, I think on the 28th of April, to determine how PVA Africa can best meet the demands of its members. So I would like to share with you some of the results of the survey and some of the responses that we got from our members. So in total, a total of 35 responses were collected, with most of the responses coming from registered NGOs and community-based organizations that are based in Africa. So some of the responses that they gave us, we classified them into monthly CSOs meetings, which aspects of the meetings they found enjoyable. So these were some of the results, just to give a fast summary of the results that we collected. So on monthly CSOs meetings engagement from the survey, we found out that the majority of the participants attended the meetings, and of those that couldn't attend indicated that it was either due to the time of the day or they didn't see the invites coming. So this was the response from the majority of the respondents that answered this question. So we are working with African Alliance to make sure how we can improve on this aspect. We also asked the question, which was the most enjoyable aspect of the monthly CSOs meetings, and the majority of the respondents indicated that they liked the meetings, and also they liked having organizations that are working within the same field and having discussions with those organizations. So they also liked about having let's say, some organizations from Southern Africa, let's say East Africa or North Africa, giving regional updates in those regions when it comes to COVID vaccine uptake, when it comes to COVID updates. So those are some of the respondents that we got from the survey. Another question that we asked the members was, what do you feel PVA Africa communications? So the majority of the respondents to this question indicated that they find the communications from PVA Africa to be very useful, especially in promoting accurate and information, and also keeping its members updated on current affairs. The majority also felt like the PVA Africa Secretariat communicate frequently and well, especially on issues of vaccine uptake and in issues of global health. So another question that we asked the members or the respondents of the survey was, how do you perceive PVA Africa as a network? So in this question, participants were asked to rate their perceptions of PVA Africa on a 4-point scale, from strongly agree to strongly disagree, to help give the secretariat members a perception of the work, the vision, and how it can be coordinated. So it was clear that the members see the value in the network and its potential to create positive change. And that is to say, it has a clear focus in what it is doing. Some of its members also see the network as being connected to and being driven by them. So these were some of the results of the survey that we conducted. There were a lot of them, but this is just a summary of some of the response that we got from the people that filled the survey. So some of the recommendations that we got from the respondents. So participants, we also asked participants, what do you recommend PVA Africa to do going forward, especially now that the World Health Organization has declared the COVID-19 as no longer a health emergency. So these are some of the recommendations that we got. So based on the feedback and the number of respondents who had not received any meeting invitations or had little information about PVA Africa's work, it may be useful to collect an information pack for new members and do a rolling monthly induction session where the work is introduced and members can update who they want to receive the meeting, where they want to receive the meeting emails and other information on this course. So these were some of the recommendations that we got from the survey. So I think, as you are aware, PVA Africa also offered 2 cash prizes to lucky winners who fully complete the survey. So to determine the winners of the survey, PVA Africa conducted a raffle. So these were the 2 lucky winners of the survey that was conducted. So the first winner was Rodrick Mhlongo. I'm not sure if I'm pronouncing the name well. And the second winner is Tulisile Mazia. So these were the lucky winners. So congratulations to Rodrick and congratulations to Tulisile. So our team will be reaching out to you with the next step on how to transfer the funds to you. So thank you. So these are, in summary, the updates that I have on the survey that was recently conducted. Thank you.
Thanks a lot, Taku, and congratulations to Lucille and Rodrick. We'll reach out to you on how to proceed thereafter. I see Winnie had a really important question. So as we close off, we have 6 minutes to close off. So I think, Winnie, I'll just give you an opportunity to vocalize your question and your concerns, and we can open it up to the members to provide some of their perspectives as well as we close off. So go ahead, Winnie. Winnie Le.
Thank you, colleagues. No, sorry, man, I'm really struggling with load shedding. I think my battery is about to go down on this one as well. No, my concern really is the post-COVID effects, and I think I'm not sure whether it's a right word to call it negligence in our communities, where people tend to think that we no longer dealing with the COVID pandemic. As much as that I am the community activist, but I also am a pastor in the church and the founder of the church. And I see a lot of this on a daily basis. And, you know, those precautionary measures that we used to encourage people to adhere to during COVID, we no longer speak about them. And even when you do encourage people to continue washing hands, simple things such as those, washing hands and stay at home when you sick, or you feel like flu symptoms and all those kind of things. And also when you go to health facilities, like this morning, I had a run around with kids. We were running an ECD center as well with my wife, to a health facility where I was dropping kids due to the outbreak of mumps in our community. And you see a crowd of people going about like it's a normal thing. There's absolutely no adherence whatsoever, or even the thinking that we still have COVID issues in our communities. And one of the comments that I just saw now is just to have ongoing communication messages going out. And I don't even hear that happening, even in our local radio stations, newspapers, and anything of that sort. I'm not sure whether this is prevalent in mostly the rural communities, because everywhere you go, there seems to be like everything is back to normal. And we hear a lot of people still, when you speak with hospital staff, talking about people that are struggling with respiratory issues and stuff like that. So I really wanted to check what more can be done, especially at grassroots level, so that this message goes to the deepest of our rural communities, that it's not over. It really is not over, and we can still save lives while it is more on a moderate scale, if you like. That was really just my concern. Thank you.
Yeah, thanks, Winnie. That's a concern that we are also facing as we do our PVA Africa work. I don't know if Christine, because Christine gave a really comprehensive kind of address about what they're doing in the county to keep not only COVID at bay, but also people informed about what's going on. But I can just let you know, as at least on our end, we realize that it's not over. And we're actually putting up digital billboards, one in Santon and one in Soweto as well, just a 12-second video, just to remind people that it's not over, but we also don't want this to happen again. And it's really important to remain vigilant and prepare for the next pandemic, just to remind how many people we lost, how many people survived, where are we now? And we believe those kinds of efforts are really useful and helpful when it comes to reminding people that we went through this, but it could happen again and it's not really over. So Christine, I don't know if you have anything to say, or anyone else, as we close off in a few seconds.
Thank you, and I'm requesting kindly if you could share with me the video. It could help me in my advocacy work. Thank you so much.
Yeah, Christine, any thoughts on Winile's concern? Thanks. Yeah, we'll do that. Yeah. Anyway, I think our Zoom link is about to cut off. So just in the interest of time and respecting your time as well, yes, we'll share the video on our website. We'll send a link. Thank you so much for giving us this time and this opportunity to talk to you. I pray that you have a good afternoon. And thank you for engaging us. In case you would like to present next month, feel free to reach out to me. And we'll be in conversation. Thank you, David. Thank you, Tom, for your time, and everyone else. Unless anyone has any other closing remarks, I can bring this conversation to a close.
Thanks, Martie.
Thank you.
Thank you. Bye.
Bye.
Thank you, colleagues.
Bye, everyone.
Bye.
Bye.
Bye, and thank you for waiting.